Hey, this is Dr. Reyes, Type of Doc. Let's talk about the basics of healthcare in the United States. And oftentimes, if you're if you're a young adult, just got out of high school, you're getting to know a person who never really paid attention to how the healthcare system actually works because your spouse took care of everything. So this is a basic primer. Number one, the king of the healthcare industry is health insurance. It's not the physicians. Oftentimes I find that the general population thinks people like me make the most decisions over the overall healthcare system. Even though we are related to healthcare, we are not all together in some sort of big blob of healthcare. The kings of healthcare are the insurance companies, the health insurance company, the Blue Cross Blue Shield, the United. I would call the queen of healthcare is going to be the hospital systems. These people are pulling in, these companies I should say, are pulling in billions of dollars in revenue. The rest of us are basically pawns. I want you to imagine a chessboard. The king is insurance, the queen is the hospital system. Included in the healthcare insurance industry is government insurance. Medicare, Medicaid is one of those kings. They tell us what to do. The insurance companies tell physicians how to practice. Whether or not I can say that legally, I don't care, because that's the reality of it. They're called prior authorizations. They deny care, right? So who's actually managing that patient? The insurance company is. So I want you to be aware of how this actually works. That way you can place credit and blame in the right area. The doctors, we will do what is best, what we think is for you, but at the end of the day, when you involve a third party organization in, they get a say so in it, and guess who wins? It's the one who pays. So if the insurance company is king and the hospital system is queen, they're the ones who dictate everything, and little old practices like mine or labs or RADs, we're just pawns on that chessboard. So please keep that in mind if you're starting to get the healthcare system into your life and you understand where the frustration occurs. At the end of the day, you could go ahead and always ask for a cash price, because if you take the insurance company out of it, then those prices usually are less expensive. For example, when I got labs done and I paid cash, it was only a couple $100 instead of like $600 what they usually charge the insurance. I'll see you at the next video, and I hope that helps of your basics and overall understanding of who really is the king of healthcare. It ain't the physicians, it ain't me, but it is the big insurance companies.